Hello, my name is Sheila Lewis. I'm a cardiac patient of Dr. Baxter Montgomery, and I'm here to tell my story of what I've experienced these last 5 to 6 months of my life. And this journey for me started back in, I guess I could say, September of last year. Was when, after going through a couple of health fairs at my job, and a few things were pointed out, a few health issues were pointed out that I needed to take care of. And so with that on my mind, and then the fact that for the last 15 years I've been struggling with obesity, trying to lose weight, been on every diet plan in the book, I decided I was going to go get a lap band. And so I went to one of the local doctors to inquire about getting a lap band, and I was told that I could not get the procedure because I had an abnormal EKG, and that I had to have a cardiologist to sign off and give me clearance in order to be able to have the procedure done. So at that point, I started basically trying to look for a cardiologist, and one evening my husband and I were watching Channel 13 News, and we saw this young doctor on there and doing something quite strange, I thought, and he was actually going with some of his patients through the grocery store and showing them what they needed to purchase and how to read the nutrition labels. And I just thought that was really, really great. Someone who took that kind of care and attention with their patients. And then he went on to talk about some of the successes that he had with his patients, and merely by helping them to change the lifestyle of eating, what they were putting into their mouth, that they could change their life and change their health. And that really caught my attention. Once I started coming in to see Dr. Montgomery about my heart, we went through a series of tests, and I can't count the number of tests that I had to go through. But at the end, the result was that I had congestive heart failure.
So we had these findings which many individuals would think is unusual for a female. However, I want to point out to our listeners that heart disease is the #1 killer of men and women. And in fact, more women die from heart disease and heart attack than men. Although she's young at the age of 46, we know that coronary artery disease can be found in individuals as young as 15 years old in autopsy studies. And some autopsy studies have shown that they can have a high prevalence of gross coronary artery disease in young men, average age of 22. So this finding should not be surprising when you really look at the science behind it. So with the agreement of the patient and her husband, they decided to take a less aggressive approach up front, and they decided to proceed with a nutritional, whole food, plant-based diet. We also added medications to the regimen. We also treated her with a non-invasive revascularization technique, or a non-invasive way of helping the heart improve its function, called ECP therapy, or external counterpulsation. So here's another view that we took of the heart, and basically we take these different views of the heart so we can get a good look at the arteries. We're able to look from below the heart, and we get an image here. If you can see where this dark part comes in and it pinches off. And this pinched off area here is pinched off due to the fact that there's some plaque or some narrowing right there. Now that could be due to maybe sometimes spasm. It could be due to the fact that there's some swelling inside the artery around the area of a plaque. But we do know that there's a significant disease right there. There's also disease in other parts which is not as easily picks up as there. So I'm going to let this play, and you can see as that artery fills up how it's going to play out. You see that narrowing right there. Okay, and so this was one area that we were concerned about. Now, when I did this procedure, I saw other areas that had some plaque in it that wasn't as severe. I didn't feel that this plaque by itself explained, all of why our heart was weak. It does contribute. This plaque here does show narrowing in one major artery, so it does explain a significant amount of the weakness. I looked at this with a couple of interventional cardiologists. I decided to hold off on doing an angioplasty or stent placement after consulting with a couple of colleagues. I performed an MRI of the heart, which showed the heart to be enlarged, thickened, and also to be weakened. So the MRI findings confirm what we saw in echocardiogram, and also an angiogram view of the MRI did also show some disease in the same areas that we saw here on cardiac angiogram.
You know, he went through some of the things that I needed to do, some of the procedures that would be available to me, and of course, you know, there was the bypass, the implants, the defibrillator, and the pacemaker, the stent, and all of that. But the very last thing that he told me was that he could help me by simply working with me with changing what I eat, what I put into my body, and then a series of meds, you know, to work with the high blood pressure and the cholesterol, that I will be able to reverse my condition. And he's seen it done. I could reverse my condition without having the surgeries, and that really appealed to me. And so, of course, me and my family said, let's do it. Now, we have been praying that, you know, that will be a way out, that I wouldn't have to have the surgery. Okay, so I would say maybe the next 5 or 6 months, Dr. Montgomery put me on a very strict vegetarian diet, and boy, I tell you, it was probably one of the hardest things I've ever done, because I'm such a huge carnivore. I love meat. I love to eat. My husband is an excellent cook. So that was very hard for me, and we actually started the diet in the month of December, which was the holiday month. All the holiday parties, the banquets and dinners, everyone was eating buffet, banquet style, and I was sitting there with my salad. And so it was it was something that I really had to make a big adjustment in my life, but I did it because the options that were placed before me and the condition of my heart was so serious, is that it was a situation of life and death. Either make a change and live, or continue the way I was going and die. And I have children, grandchildren, and I want to be here for them. So I made the sacrifice and stuck to the diet as much as I possibly could. And so over the next 5 months, I had to go through 35 sessions of ECP therapy. I took medication for my blood pressure. I think I had 2 prescriptions for blood pressure and 1 for cholesterol. And of course, I had the heart medicine for angina, which helped to alleviate some of the chest pain that I was having. I did that up until May of this year. Actually, on May 19th, I had to go back in for a 4-hour MRI. Dr. Montgomery got the results, and I called in, and he told me that he was scratching his head, and some of the doctors at Hermann Memorial were scratching their heads, because the MRI showed that there was no blockage in my artery, which in December it showed 85% blockage. It also showed that my heart was beating normal. It was pumping normal, and it's just amazing, the results.